All right, I'm back for round two with Dr. Tommy Wood. Tommy, thank you again for doing this.
Oh, no problem.
Awesome. So in round one, hopefully people have watched that video. We covered effectively getting started, a ton of things in there, what might make it easier for people to get started, what mistakes a lot of people make, so it slows down what they should be thinking about when they're getting started. In this masterclass, you're going to cover weight loss, because weight loss is something that so many people are interested in for good reason, because so many people are overweight, particularly in North America, but obviously increasingly around the world as well. So let's start with the most obvious question, since we're doing a keto masterclass on the keto diet at a keto summit. Is a keto diet a good way to lose weight?
Yes, absolutely. And those, like, if we're talking about research, those studies that have done it have shown, particularly over a long period of time, dramatic improvements in weight or weight loss. When you're comparing diets, even though sometimes the differences are quite small, you almost always see greater weight loss on a low carbohydrate or a ketogenic diet. So, for people who are, overweight, obese, this is definitely one of the ways people should start by trying out a low carbohydrate or ketogenic diet to try and initiate weight loss. Yes, absolutely.
And why is that? What is it about a keto diet that generally makes it more successful than other diets?
So there are a number of different reasons. One of the most important is the fact that you eat less. So when you are in ketosis, so one of the reasons that we enter ketosis is to support our bodies when it's in starvation mode, keep the brain working, when essentially you are starving or you don't have enough food around. And one of the reasons that, one of the ways it does that is by making you less hungry, right? Because the idea is that you should be able to function so that you can go and find more food. That's one of the reasons why we feel we adapted or evolved to go into a ketogenic state. So one of the things it does is it just makes you less hungry. So you eat less and your caloric intake drops. Then sort of the next important reason people talk about is the fact that insulin decreases, and insulin is a very good storage hormone. It's very good at storing fat. And if that decreases, and that's we talked about in the last one or in the last masterclass, that we need insulin to drop in order to get into a ketogenic state. And then obviously when insulin is lower, then we're in less of a fat storage type mode. So we're going to eat less and we're going to store less. That's essentially the basic reasons why a ketogenic diet will help with weight loss.
So let me throw, this is a bit of a tricky question in there, but is it important still for people to not eat too often on a ketogenic diet for those reasons?
Yes and no. So there's a lot of research now looking at restricting our feeding window or intermittent fasting and things, and they go hand in hand with a ketogenic diet. Absolutely. And so we also know that the smaller the feeding window, then actually the less restrictive you almost need to be in terms of your macronutrients or your total calorie intake. And that's based on both some human studies and some animal studies, mainly animal studies. So eating less often will absolutely help. And, maybe just getting into sort of traditional meal times, reducing snacking, and then, potentially you can just move to 2 meals a day, 1 meal a day, one big meal a day. That's what some people do. But equally, if you're somebody who's just getting into it, maybe keeping up some regular meal times are just going to help you feel better, keep your energy levels more stable, because, it's just usually when people are getting into this for the first time, they've have some weight issues, they're probably going to be used to eating very regularly. And then as soon as you start taking those meals away, it's going to cause a big sort of cognitive block and you're going to feel deprived, and then you're less likely to stick with the diet. So just starting out by, eating the right things. And then maybe over time you can adjust your meal timings, but sort of making sure you get a good period of time overnight, where you're not eating maybe 12 or 16 hours, at least as maybe 12 to 14 hours is a good idea, right? So you eat your last meal 2 or 3 hours before bed, and then, you're not sort of eating continuously will definitely help.
Awesome. Are there certain people who are likely to see better results from a keto diet in terms of weight loss and certain people who are not? And if so, how would, what do you usually see in terms of the people who are more successful?
So if it's purely for weight loss, then I think it can benefit almost anybody. And I think everybody will see some initial weight loss. I think where things get complicated is when you have other diseases at the same time. So say somebody has an autoimmune condition, it's often people with autoimmune conditions. Maybe they have some thyroid problems, some hormone problems, and then they can tend to struggle a little bit more on a ketogenic diet. And I think that might be something they need to take into consideration. In general, I do often think that men do better, but women can absolutely benefit, but they may need to sort of be more gentle about it, and sort of just slightly more cognizant of other symptoms, and looking at things like their cycle and things like that, and making sure that is all staying the same, and they're not sort of causing any problems there. So I think anybody can try it. Usually, if you have some kind of medical condition, I'd definitely discuss it with your doctor.
Right.
But from there, it should benefit most people.
Yeah. Do you? Part of the reason I asked that question is because I know just from our own experience, a lot of people we know, including family members, friends, but also people that we're not close friends with, we've seen a lot of people have a lot more success who've traditionally struggled to lose weight, who maybe have more advanced metabolic syndrome in a variety of ways, like more insulin resistance, higher blood glucose, and for whatever reason, it seems like those are the people who often see the bigger benefits from a keto style approach versus other approaches. Is there a particular reason for that?
Yeah, so there's absolutely some research to support that. Some small studies, clinical trials showing that basically people who are more insulin resistant may see more of a benefit from a carb-restricted approach, carbohydrate-restricted approach, or ketogenic approach, compared to people who maybe are more metabolically healthy or have less weight to lose. And then maybe just anything that restricts their calorie intake may be enough to stimulate weight loss. And I think particularly, like you said, it's probably going to come down to things like insulin resistance, maybe also leptin resistance, particularly when people have gained a lot of weight, or are sort of obese or heavier. And that's just because you're reducing the levels of those hormones. So then that will help the signaling become better, because basically if insulin goes up, your body stops listening to it. That's what we call insulin resistance. And then you can't get that normal signaling. So if you can dramatically reduce insulin, and one of the best ways to do that is by not or dramatically reduce carbohydrate intake, then you're gonna start to sort of improve that pathway. And so people who are more insulin resistant, maybe they've measured their lipids, they have a high triglyceride to HDL ratio, or they have high fasting insulin. Or there are lots of ways that people may have figured that out. Then those people particularly will absolutely benefit, and may benefit more.
Right. And often, I guess, if they have a lot more weight to lose, then you're going to see bigger results anyway. It's hard when you only have 10 pounds to lose. There's only so much benefit you can see.
Yeah.
If someone's just getting started to lose weight, or maybe they've been trying for a long time, but they're just getting started on keto to lose weight, you mentioned one of the main benefits, and we talked about this in the other masterclass as well, is that a keto diet just reduces your hunger automatically in a lot of ways. However, I know, and I've just heard, and even from myself, my own experience, that there are, often people still get hungry, whether it's psychological in terms of they're just used to eating a little more. Is there something that people can do when they're getting started along the way to help reduce that hunger, especially in the first few weeks before they kind of get fully adjusted?
Yeah, so I think a lot of that is going to be to do with, like I said in the last masterclass, building some kind of regime, building some kind of plan, right? And often we talk about this is sort of in all of the weight loss worlds. Often people get hungry because they're actually thirsty. And there's often you don't really, the signals get mixed up, and you just know, oh, I don't feel good. I'm maybe hungry. I should eat. And like we talked about before, you actually retain fewer electrolytes, particularly when you start adapting to a ketogenic diet. So particularly making sure you're drinking enough water, and that may be enough to help. But then also like planning some small movement breaks, things like, we talked about walking in the last one, and something very similar, and that's kind of to get you out of the habits where, previously we just sort of, we get bored, we snack, and then that's sort of gonna lead you down the same paths. But equally, you can, if we talked about the number of meals per day. I think when you're getting into it, you could just start by just making sure you're eating the right thing. So I don't think snacking is necessarily a bad thing. If you need to snack, as long as it's sort of within like the macronutrient ratios you've figured out for yourself, I think that's fine. Particularly as you're getting used to it, just because then you're getting used to the foods, you know what you're going to eat, and you have that kind of plan, and you have things sort of created in advance, so you have those things available, or else you're going to feel deprived again, and you're less likely to stick with it. So making sure you're drinking enough, again, making sure you're getting those micronutrients in, which can affect how you feel, particularly as you adapt to the diet, and again, having the plan. And snacking is okay, as long as it's kind of within the restrictions. We want to call them restrictions, within the kind of the remit of the diet. We'll call it that.
Well, and this is something you and I have discussed a little bit, but I know it's a common question. You mentioned being able to stick with it. One question people often have, though, because it's the case in other diets, is should they restrict how much they eat? Should they be looking at the amount that they eat, the amount of calories they eat, especially when they first get started?
So the answer is yes. And particularly when it's for weight loss. So there's a lot of people talk about this, and maybe like Jeff Volek, Steve Finney, if people have heard of them, are kind of maybe the first people to really sort of point this out. I know Luis Villaseñor, you talked about him. He talks about this a lot as well. And it's that if you're trying to lose weight, yes, you want to be burning fat, but you want that fat to come from your body, right? So if you eat a lot of fat, that's going to stop the amount of fat that your body burns. Is kind of it's actually a relatively simple equation. So particularly when you're starting out on a weight loss type diet, so using ketogenic diet, you should still have a rough idea of how much you want to be eating, and making sure you're not overeating. Equally, they've done studies where they put in place the carbohydrate restrictions, and then everything else is kind of an unlimited calorie diet, and people still lose a huge amount of weight. These are obese patients. So the ketones will definitely help with satiety, and just maybe giving yourself a rough idea of what you should be eating, so you just know. But then hopefully, as you start to adapt, your hunger will decrease, and you'll naturally just eat less, and then you don't need to be sort of forcing it upon yourself. And that's what makes it easier to stick with, right? Rather, because if you just feel hungry all the time, you're never gonna stick with it, because it's miserable.
Do you feel like somebody could start a keto diet for the first 3 to 4 weeks without caring at all about how much they ate? I mean, without really trying to intentionally restrict, without intentionally trying to look at calories, and go from there, see if they're losing weight, and then at any point that they maybe stop losing weight or slow down, then they could start looking at how much they're eating and the calories?
Yeah, absolutely. And I think as long as you're eating the right foods, and what you need, just to sort of make sure you're in the target range. So it's particularly, you make sure you're removing all sort of starchy processed carbohydrates, and you have a rough idea of the sort of, and then just green leafy vegetables, low carbohydrate vegetables, and then meat and eggs. If that was kind of like the basis of your diet, then I don't really think you need to weigh or measure anything, because you'll just naturally eat what you can eat. Where people start to struggle, I think, is when you bring high fat dairy into the picture, cream and butter and stuff like that, and it's much easier to eat large volumes of that, just because it's so calorie dense. So if you're eating a lot of cheese and cream and butter and things like that, then maybe that might make it more difficult. But if you're just eating meat, eggs, and green leafy vegetables, then you probably don't need to weigh or measure anything.
Right. One of the things you mentioned about wanting your body to burn fat, Chris also interviewed Kate Shanahan for this, and I forget how it came up, but he asked her about things like MCT oil, and she said, well, I'm not opposed to it. She's like, I think it's fine. It doesn't have any of the bad properties of vegetable oils in terms of going rancid very easily or being easily oxidized. But she's like, I don't recommend it to people, because, she's like, most of my clients want to lose weight, and when you put in the extra MCT oil, all it does is allow your body to burn the MCT oil rather than the body fat.
Yeah, and that's true. And I think there's the one good thing. So, I mean, I guess we haven't mentioned yet if people haven't watched the other videos. So, MCTs, medium chain triglycerides, are basically very short fats that get turned into
Right.
ketones very easily. They don't get generally get stored as fat. They mostly get taken straight to the liver and turned into ketones. And I think that can be useful sometimes to kind of, if you are hungry, then you sort of
Right.
increasing, bumping up your ketone levels may be a good way to sort of get on top of that. But equally, ketones kind of feed back and stop you mobilizing more fat. So if your ketones get very high, you will turn down the amount of fat that you're burning because your body has to be in some kind of balance, right? So it recognizes that when ketones are very high, it thinks, well, hang on a second, I'm burning loads of fat here. I want to make sure I still have some just in case. And then
Yeah.
so it reduces that. So there is some feedback mechanism there, and she's absolutely right that if you sort of ramp things up artificially, say with exogenous ketones, MCT oils, you might reduce the amount of fat that you're burning from yourself. One thing, particularly with MCT oils, though, is that it's actually quite difficult to eat a lot of them because you just end up getting it ends up coming out the other end, or
Right.
a lot of people might have some kind of digestive distress, or I mean, they don't taste like anything. So
Yeah.
I'm not that worried about them just because I think they're very difficult to eat in large quantities. But again,
Yeah.
it's not something you should be relying on because there's no nutrition in there.
And Dave Asprey talked a lot about that too in his interview with Chris in this summit. So people can watch that also. So I think you've answered this partially in the past couple questions, but a lot of people on pretty much every diet, but also definitely on a keto diet, they'll lose weight for a while and then they'll stall out, they'll plateau. There are a number of different words for it. What are the main causes for that, and how do people normally get through that, or how do people best deal with that?
Yeah, so I think what it really takes is just sort of, make sure you sort of double check everything and sort of look at how things, how you are overall. So, maybe you need to do some food diarizing, maybe sort of like everything's kind of crept up and total intake has crept up, and or maybe you're less strict about what you're eating. And that's the standard answer, right? Everybody just says that when you reach a plateau, then you're just not doing it right anymore. That's kind of like the standard answer. You're eating too many carbs, and that's it. But I will actually. This is going to be my interview with Chris on the summit is about when keto isn't working, but then again we go back to all that other stuff that we were talking about. So maybe you actually find that you're eating all the time, and so you're just like continuously putting food into the system, and that can cause problems. Maybe you're not sleeping properly, maybe there's stress, maybe there's an underlying infection, maybe you've generated some hormonal imbalances. And so when things really start to stop working, it might take a little bit of investigative work. It might just be that you sort of relaxed too much, but then equally there might be something else that's going on, and you just might need to do a little bit more digging, and then maybe you need to work with a practitioner or whatever. But it's again, if you have some other health conditions going on, those may be causing problems, and then you just need to check your thyroid, check all those other things, make sure everything else is in order, and then sort of just go back and look at the lifestyle, but then make sure that you haven't strayed too much from the diet. But just remember that it's not necessarily just the diet that's causing issues. There might be some other things that you need to look at as well.
This is kind of a vague question, but it's related to what you just said about people, digging into some of those issues, maybe working with a practitioner. But is there, and maybe this is just a bit of conjecture because it's such a vague question, but is there potentially a reason or a time for people to stop being as strict with their keto diet, maybe introducing some healthy carbs back into their diet at some point down the road? What are your thoughts on that?
Yeah, so I think that when you look at something like a ketogenic diet, I think it's a tool, and so you're using it for a specific reason. So say if you've reached your weight goals, and it's no longer working for you, or you want to maybe just branch out, then adding some of those things back in isn't going to be a problem. If you are somebody who's treating a disease, epilepsy, cancer, something like that, you're probably going to have to stick with it, particularly if it's worked. You definitely don't want to move away from that. But we see a lot of people with autoimmune disease, particularly I mentioned that a number of times, who actually just feel better by increasing their carbohydrate intake, and there's a number of reasons for that. So again, use it when it's a useful tool, but then equally, we talk about particularly sort of if you're talking about the performance well, we talk about metabolic flexibility, right? Sort of the ability to use the right fuel at the right time. And so most people rely on a carbohydrate-based metabolism. When you go onto ketogenic diet, you switch over to more of a fat-based metabolism. But essentially, the person who's metabolically healthy wants to be able to do both. And when you spend long periods on a very low carbohydrate or ketogenic diet, you essentially become metabolically inflexible in the other direction, right? So then you're actually less good at metabolizing carbohydrates. So you may actually want to reintroduce those just to sort of build the most robust system, particularly if you're an athlete. We're going to talk about that in another masterclass. You want to be able to use the right fuel at the right time. So, in any of those scenarios, then I think bringing back in carbohydrate, again, real food, nutrient density, very important, and sort of balancing those the right way can be very important, and in a lot of people it's beneficial. So use the ketogenic diet when it's having the effect that you want, and then maybe try and build a more robust system by bringing some things back in. Some people will stay on a ketogenic diet forever and feel great, and that's perfect. Some people may feel that it only works for a certain period of time, and then they need to adapt, and that's also fine.
Right. And one thing you just mentioned is one thing that Chris discussed a lot in the video to the guide to supplements and in the supplement guide that we produced, which is that when you're on a keto diet, or really when you're on any diet that is restricting, a large amount of foods, you've really got to look at some of those micronutrients that you might be removing from your diet or not getting enough of in certain ways.
Yeah, absolutely. So again, if you're stalling or causing problems, and then or you're not seeing the same benefits, and then you realize that actually it's because all you're eating is cheese, then then you sort of need to look at where again, food quality, nutrient density, getting sort of a broad range, and
you might need to rethink your whole diet in that case.
Yeah, absolutely.
Awesome. Well, Tommy, thank you so much. I know a lot of people have lost a lot of weight on keto. We know a lot of people who have. It's one of the places I started, and like you said, the studies are showing that even when it shows a minor difference, over a population level, and for a lot of people, it just makes a really big difference, particularly for people who kind of far advanced down that insulin resistance pathway or metabolically insensitive pathway. So I think this will be really great place for people to start. And obviously, if you haven't listened to the 101 Masterclass, listen, that is great. And obviously all the other great interviews, including another one with Tommy in the Keto Summit. So thank you so much.